Hey Jason, hey Maria. Before I leave, I just wanted to talk to you guys about something I've been noticing throughout the night. I think I've been noticing that you're a little dehydrated with all the water you have been drinking. I've noticed that you feel nauseous. I heard you say that earlier. And then I noticed that your skin isn't looking or is looking very pale and clammy. And I've also noticed that your jaw is giving you some types of issues. Is it tight? It's tight. Okay. Well, unfortunately, all these are symptoms that kind of lead to are associated with cardiac arrest. Now, my personal opinion is that we should call immediate medical attention, just in case, as it's always better to overreact than underreact in situations like these. Um, Now, Maria declines. She doesn't want to see them, or it's okay. But shortly after, she falls. Now, Maria falls and I catch her. So as I catch Maria, I let Jason know, Jason, I need you to call 911. Let him know that we suspect that your mom is having or is going to cardiac arrest. I check for pulse. I check for breathing. I don't get a pulse, and I do not see her chest rising. So, and I do not get any verbal communication from her. So let him know that she is unconscious, unresponsive, and is not breathing, nor do we have a pulse. Let them know where we're at, and yes. And then after that, I need you to go to my car and run and grab my EMR bag, as that will have equipment where I can assess and keep her stable until EMR or the EMT or more advanced medicals come. Now, as Jason's running to the car, I am laying down Maria gently on her back as I need a flat surface. I check my scene. We're watching movies, so I assume we're in the living room or somewhere, something like that. So then I push all the furniture out to give me optimal space to access her fully without any issue. So now as I'm operating on her or assessing her, I checked again. She's unresponsive, unconscious. I have no pulse. I have no breathing. So with this, I cannot start CPR as I do not have my PPE. But with that, I can do. I can start my chest compressions on her just to keep that blood flowing in her body, getting that oxygenated, rich blood. As I'm doing that, I grab my left hand. I put it over or underneath at the bottom of her breastbone, and I grab my fingers, my right hand, and I interlace them with my left hand, and I just put my palm on her chest and pat my shoulders over my hands, and I just do the compressions of 30 until Jason gets back. Once Jason arrives, I then have to hurry. I can only stop for less than 10 seconds until further damage is going to happen. So then I put my gloves on. I put her ventilation mask. I put the ventilation mask over her jaw, over her nose, and I surely secure it with a E grip, making sure the ventilation is securely on her face. Now I either could have used that or a manual CPR where I could have had Jason pump air into it, but he's not a trained professional or EMR like I am, so I have to do this assesses this work by myself, as it's probably the safest for both of us, for all three of us. So as I hurry and put my gloves on, put the ventilation mask all in under 10 seconds. I continue back with my compression and CPR. I do 30 compressions for every 2 ventilations. That means I'll compress her chest 30 times and I'll breathe into her 2 times. Now, when I breathe into the patient, it has to be enough force where I can see the chest rise and fall back down, as well as my compressions. I have to do it at least 2 inches deep to feel the 2 inches deep to get the blood pushed through the heart, and I have to let it fully recoil, as that is very optimal to create the best CPR. And then as I'm doing this, as we're waiting for professional, more advanced medical attention to arrive, I tell Jason to hurry and grab my AED kit out of my bag, and as I'm doing the compressions, I tell him to place one of the pads above her left chest, right above her left chest. Or sorry, first we should remove any clothing that is restricting any breathing or airways or anything like that. Then I asked Jason to put the AED pad, first pad above her left chest, and the second pad uh, right below her right chest, kind of towards the little of the rib, but not all the way. As they then the two pads, the charge is in the path of where the heart is going. And then as I'm still doing the chest compressions, as he's still setting it up, I let him know to turn it on, and it's going to give us instructions on what to do. Now, the instructions are going to tell us to put the pads on and everything like that, like I already told Jason. I'm going to keep doing my compressions, and then as the AED is gauging her heart rhythm, her heart electrical rhythm pulse, I will keep doing the compressions until I hear the words clear from the AED, or AED is all set up for me to promptly give the electrical shock myself. Now, when I hear the words clear, that is when I stop doing my chest compressions, let the AED try to bring her heart back in rhythm. And if it's not doing that, I wait for the clear or wait for the charge to be done, and I go back to my chest compressions. And then I will let the AED do its thing again. If I hear the word clear, I will stop and let it try to get her heart back into its rhythm. And if it's not going, I will continue this process until advanced medical attention arrives, or until her conscience or state changes. And if her state does change, then I will just quickly and cautiously ask her questions, see if she's in a state of conscious mind or not, and this and that. I will continue to have her just remain calm, breathe in and out. Unfortunately, I do not have any air tanks of my own or any oxygen, any excess oxygen that I could give her body, unfortunately, besides my own. If she's conscious, if she's not conscious, then I continue doing the compressions. I continue to stay with the AED until advanced medical trainees or paramedics, anyone who's at a higher level of me, comes and can take her off my hands. Thank you.